Hemophilia. Hemophilia can be inherited or caused by a genetic change, however it is usually inherited. Hemophilia is caused by a defect in one or more of the genes that determines how the body makes blood clotting factors. This gene is typically located on the X chromosome. Hemophilia is a blood coagulation disorder. It can be classified into 3 different types. This classification depends on which clotting factor the patient is missing. Type A hemophilia is the most common, whereas type C is mild. For patients with hemophilia type A, they are missing clotting factor number 8. This accounts for about 80% of all hemophilia cases. For hemophilia type B, they are missing clotting factor number 9, and this accounts for about 15% of all cases. For hemophilia type C, or von Willebrand disease, they are missing the glycoprotein, and this accounts for about 5% of all cases. For patients with hemophilia, anything below a certain range in blood clotting factors present will indicate. If a patient has 5 to 40% less clotting factors in their blood, they're considered mild. If they have less than 1 to 5% clotting factors, they are moderate. If a patient has less than 1% of the clotting factors present in their blood, they're considered severe hemophilia. The signs and symptoms that come with hemophilia depend on which of the blood clotting factors is missing. If a patient has a mild deficiency, bleeding will typically only come after trauma or surgery. However, if they have a severe deficiency, the bleeding can occur spontaneously and without notice. Some common signs and symptoms of hemophilia include internal bleeding, which is the most worrisome for people with this disease because it can cause major damage to organs and tissues. Internal bleeding typically occurs in the gastrointestinal tract and the intracranial. Patients also experience easy bruising, prolonged nasal or oral bleeding, and deep tissue hematomas. Many patients with hemophilia also experience hemiarthrosis, which typically occurs in the knees, ankles, and elbows. In addition to all of the above signs and symptoms, patients between the ages of 6 and 18 will also typically show signs of below normal motor function, low academic performance, and emotional behavioral problems. Below you can see some examples of pictures of patients with hemophilia. You can see the bruising caused by internal abdominal bleeding, hemiarthrosis in the elbow and in the hand. Hemophilia usually affects males but can also occur in females. Hemophilia affects approximately 1 in every 5,000 male births. There are approximately 400 babies born every year with hemophilia. Every 8 out of 10 people who have hemophilia are type A. 75% of people with hemophilia have yet to be diagnosed and therefore receive no treatment. Treatment and care for 1 year for a patient with hemophilia can cost $1 million or more. There are approximately over 400,000 people worldwide diagnosed with hemophilia. Until the 1960s, the life expectancy for a person with hemophilia was only 11 years. Hemophilia can be diagnosed in a couple ways, but is typically only diagnosed with a blood test. Hemophilia is typically diagnosed in children and young adults, typically between the ages of 9 months to 2 years. However, if there is a family history of hemophilia, it can be detected during pregnancy. Hemophilia is not something that you can prevent. However, there are ways to prevent excessive bleeding and protect a patient's internal structures. People with hemophilia are encouraged to exercise safely regularly. People with hemophilia should also avoid using blood thinners, certain pain medications, and contact sports or activities. People who have hemophilia, it is recommended they do not play hard contact sports, as this can cause serious bleeding issues. If a person with hemophilia were to have a brain bleed, the symptoms could range from mild to severe. Brain bleeds in patients with hemophilia can occur from something as simple as a slight bump on the head, so all trauma to the head should be avoided as much as possible. At this time, there is no cure for hemophilia. Hemophilia is typically treated with replacement therapy, where they replace the missing or low clotting factor. People with hemophilia may also use physical therapy to help ease the symptoms caused by excessive bleeding in joints. People with hemophilia type A are typically managed with the administration of cryoprecipitate or other factor VIII concentrates. People with hemophilia type B is typically managed with the administration of fresh or frozen plasma or cryoprecipitate. With proper treatment, the life expectancy of a person with hemophilia is only approximately 10 years less than that of a healthy person. But the life expectancy also depends on how a patient responds to treatments and the way they choose to live their life. Without treatment, patients often die before adulthood. Without treatments, patients are 4 to 6 times more likely to develop severe bleeds that lead to death or other serious injuries. April 17th is World Hemophilia Day. This day is used to raise awareness for patients with hemophilia and also to raise funds for future treatment options. People such as Alexander Borstein, Queen Victoria, and Richard Burton are said to have had hemophilia. It is also rumored that Genghis Khan, Mother Teresa, and Abraham Lincoln also suffered from hemophilia.